Hi, I'm Dr. David Haase with the MaxWell Clinic. And it's very common to get the question, hey, do you treat this condition or do you treat this disease? And at MaxWell Clinic, the focus is not on just treating disease, but more on understanding and caring for humans. This is an interesting way of looking at things because the medical field that I was trained in, when I went to Vanderbilt and Mayo Clinic, I was trained in a disease-focused approach. Matter of fact, that's what my license says I do. I diagnose and treat disease. That's what the license to practice medicine allows me to do. And that's a wonderful thing. But what is a disease? When we name a disease, we're recognizing that there is a human who has a pattern of symptoms or laboratory abnormalities they are currently expressing that is common to other humans. And so we give a name to it. And so a diagnosis is almost always naming a group of people that are generally fit together. That's useful when you're doing research, but when it comes down to really caring for an individual, there are no two humans that experience a condition in the same way. And that's why the approach has to be individualized for optimizing care. Health is really about your overall well-being, not just suppressing the symptoms of some named condition. The MaxWell approach to personalized medicine is a commitment to understanding your story, your lifestyle, your environment, your genetics, and to uncover root causes. And we have a wide variety of tools available to help us do that. If we're interested in the brain, we have quantitative EEG brain mapping. The gut, we have many different microbiome tests and gut permeability tests. Oh my gosh, I can go on because we have so many diagnostics to look at the glycocalyx, to look at blood work. We work with over 50 labs from across the world. We're one of the most comprehensive lab testing centers in the United States. But not just the investigations that we do, the interventions we do are all based on our team. Our number one value at MaxWell Clinic is we are MaxWell. And that means that we all are part of the solution, including you, if you happen to be working with us. This team approach to care brings in clinicians, dietitians, coaches, advocates, and the rest of your outside of MaxWell Clinic care team. We really prioritize therapies that have a lower potential for harm before interventions that have a higher potential for harm. It's often been said, first do no harm. Well, that's kind of silly because even just breathing has the potential for harm. So I like to say first do least harm. And so this is why we do a lot of lifestyle medicine. We utilize some natural therapies along with cutting-edge interventions, pharmaceuticals, referrals to excellent subspecialists, but most of all, long-term support, a relationship where we can get to know each other, and that takes time. We actually put time in our schedule in our evaluation process, so there's enough time to really listen to what's going on with you. And so we can focus on the most important points and prioritize those longitudinally. So whether you're facing complex and chronic conditions or seeking health optimization, our clinic's approach is designed to meet your unique needs because the entire system has been built to enable your body to create health. And that's how humans thrive. We have some really remarkable people who have come through. Patient that really still stands out to me is a lovely 26-year-old woman. She was obese, she was drinking a lot of alcohol. She had been on multiple antidepressants, Lexapro, Zoloft, Celexa, Selegiline. She had been on lithium, she had been on Luvox. She had had electroconvulsive therapy done several times for the treatment of severe depression. She was told that by her doctor they were trying to have She and her husband actually wanted to have kids, and she wasn't able to have a menstrual cycle. She didn't think she could have children. She had aches and pains everywhere. She wasn't able to really hold a job. Her family was very disparaging of her situation. And she came and said, can you help me lose weight? And that's what she came for. But if you really sat with a person and you ask, well, what do you want your health for? Because health is not a end goal, it's a means goal. It helps us to live our life, to pursue our passions, to live our dreams. That's what health is for. That's why we actually call it MaxWell rather than health, because your MaxWell is different than anybody else's. So we started an evaluation process, first of all listening, and then doing some laboratory tests. And it turns out she had incredibly high levels of lead and mercury in her system. On genetic analysis, it was very clear that she had some uniquenesses in processing these metals and also had some pretty profound exposures. We brought out a history of head injuries. Her quantitative EEG, when we did a brain map, we were able to actually show her in color how her brain was working inefficiently. We also recognized there were some hormonal issues going on and immune issues. And we set up a plan to address multiple things simultaneously, because the body heals best if you support multiple things simultaneously. And through neurofeedback, through heavy metal chelation, through the process of nutritional supplementation, dietary change, counseling, this woman started feeling better. Her pain went away, her fatigue improved. She started to actually work with her mother, who was a real estate agent, and she was now showing homes. And she was very excited that she felt so confident in herself. She had lost some substantial weight. And then she disappeared from the practice. We didn't know, well, where'd you go? Only to come back in 2 years carrying her first child. And she was down another 30 pounds. She had taken over the entire business for her mother. She was moving forward in her life. I didn't see her again until another 3 years later, where she brought her second child in. Sorry, I didn't expect that. But the body is what creates health. And if we find and address what are those factors that are impeding its ability to do so, and what are those factors that are missing that the body needs, we call it, remove and replenish. We retrain the body that is kind of stuck in its abnormal patterns, or we repair things that are damaged. That's the whole process of creating health. It's through a personalized approach, comprehensive. Sometimes the worst thing that you can have is to get a diagnosis, because then your clinicians and you may believe, oh, we know what's going on. Somebody gave it a name. BS. No, giving it a name is just the beginning of the process of understanding what's actually going on. And it is the beginning of having more and deeper questions about how did we get here, and what are the things we can do to unwind this situation. So healing involves addressing factors way beyond the disease, like lifestyle, mindset, nutrition, and it's different for every person. So I wanted to let you know your health journey starts here and now, right this moment, actually, because you can change your belief system. You can change your relationship with your body. And instead of asking, hey, do you treat my condition? Start asking, am I ready to feel better? Or what are the things I want my health for? Do I want to be able to roll on the floor with my grandkids? Do I want to be able to enjoy music more fully? Do I want to have, do I want to pursue a career? Do I want to just enjoy your sleep more? Do you want to have more enjoyment, achievement, and have that for a longer period of time? Start asking those questions, and then get curious about what could it take for you to get there. So one thing you can do, take the next step. Schedule a free information call at MaxWell Clinic, and we'd be happy to tell you about how the clinic can help. But know this, that no matter what, if you work with us or you go on another path, your body is designed to heal. and really give your body the respect. Love yourself. You're worth it. You're infinitely valuable. And I want to remind you of that if you maybe have forgotten for a little bit. So I wish you well. It's Dr. David Hosey with MaxWell Clinic.